Hi, my appointment for my second dose was 7 p.m. at Genesis Center. My GPS will help me get there and hopefully there would be no hassle and delay. The new immunization site is at Genesis Center. It's one of the two Alberta Health Services run sites and 8 participating pharmacies providing COVID-19 vaccine to Calgarians in the northeast quadrant of the city. The site has 10 vaccination stations and has the ability to roll out approximately 60 vaccines per hour. Genesis is one of the 24 Alberta Health Services immunization sites in the Calgary zone. Currently, Alberta Health Services has a total of 116 immunization sites across the province with available vaccine supply. Alberta Health Service is committed to immunizing 10,000 people across the province on average per day. That amount will increase pending more vaccine supply. We recognize the local geographic area of Northeast Calgary was one of the hardest hit communities during the second wave of pandemic in our province, says Rohan Soni, Minister of Community and Social Services. The government of Alberta continues to work collaboratively with local community partners and Alberta Health Services to reduce transmissions and prevent the spread of COVID-19 in all communities. This includes supporting eligible residents in Northeast Calgary to get immunized close to home. Genesis is one of the two Alberta Health Services immunization sites in the Calgary zone engaged in the early rollout of the COVID Shield AstraZeneca vaccine to Albertans age 50 to 64 and First Nations, Métis, and Inuit individual age 35 to 49 who are healthy and do not have a severe chronic illness. Appointments will open in stages by birth year, 1 year at a time, while supply lasts. Alberta Health Services has received about 58,500 doses of COVID Shield AstraZeneca vaccine to date. These doses are being distributed to Alberta Health Services immunization sites across the province. All vaccines approved for use in Canada are safe and effective. COVID Shield AstraZeneca is proven to be highly effective in preventing serious illness and death in healthy adults 18 to 64, says Dr. Cherry Jordan, Alberta Health Services COVID-19 Vaccine Task Force co-lead. We encourage all Albertans to get immunized as soon as they are eligible. The COVID Shield AstraZeneca vaccine is not available in pharmacies at this time due to limited supply. For more information on vaccine types and which Albertans are eligible to be immunized at pharmacies, refer to Alberta COVID-19 Pharmacy Immunization Program. Genesis Center is open 7 days per week from 7 a.m. to 3:15 p.m. with extended hours from 7 a.m. to 11:15 p.m. for the first week starting March 12. COVID-19 immunization is by appointment only. There are no drop-ins. Other COVID-19 vaccines, Pfizer, BioNTech, and Moderna will be offered at this site after March 24. If you noticed in my video, I had a hard time looking for the immunization site. Unlike my first dose of vaccine, it's easy to locate. It's good I have ample of time to figure it out. As compared with my first dose, I didn't feel any pain at all. I've waited for 7 days before I made this video. And thank you, Lord, I have not experienced any adverse effects. What are the benefits of getting vaccinated? The COVID-19 vaccine produces protection against the disease as a result of developing an immune response to the SARS-CoV-2 virus. Developing immunity through vaccination means there is a reduced risk of developing the illness and its consequences. This immunity helps you fight the virus if exposed. Getting vaccinated may also protect people around you, because if you are protected from getting infected and from disease, you are less likely to infect someone else. This is particularly important to protect people at increased risk for severe illness from COVID-19, such as healthcare providers, older or elderly adults, and people with other medical conditions. For now, if you've been fully vaccinated, you will still need to follow guidance at your workplace and local businesses. If you travel, you should still take steps to protect yourself and others. Masks are required on planes, buses, trains, and other forms of public transportation traveling into, within, or out of the United States and U.S. transportation hubs such as airports and stations. Travelers are not required to wear a mask in outdoor areas of a conveyance like on a ferry or on the top deck of a bus. CDC recommends that travelers who are not fully vaccinated continue to wear a mask and maintain physical distance when traveling. Fully vaccinated international travelers arriving in the United States are still required to get tested 3 days before travel by air into the United States or show documentations of recovery from COVID-19 in the past 3 months, and should still get tested 3 to 5 days after their trip. You should still watch out for symptoms of COVID-19, especially if you've been around someone who is sick. If you have symptoms of COVID-19, you should get tested and stay home and away from others. People who have conditions or are taking medications that weaken the immune system should continue to take all precautions recommended for unvaccinated people until advised otherwise by their healthcare provider.